if you don't ever do what you really want to do, you will always spend your life somehow trying to get back to it.
Yeah.
Like, I'm so grateful that happened.
Yeah.
I believe every skin tells a story.
Yeah.
A story from when you were a child, believe it or not.
Yeah. But there is so many other things, and I have known so many people who have struggled on something like Roaccutane and hated the side effects and really struggle with their mental health through it.
You know, avoiding sun damage is hard. Treating sun damage is harder.
It's
How's my
accumulation.
skin going to look like when I'm 40 and 50, and what you do in your 20s and 30s ultimately gives you those results in the later decades, for sure.
Well, this is what we've been trying to tell you.
Yeah.
Have a consistent routine.
Yeah.
Don't overuse actives.
Yeah.
Repair your skin with a good base foundation, and you're going to have really nice looking skin.
It's just the trends.
Yeah.
People love trends. Your skin is telling you something.
Totally.
You know, it's literally giving you a warning sign.
It's telling you something emotionally,
yes,
physically, you know, environmentally. It's huge. So without further ado, this is Skin and You. If you are listening, I hope this helps you glow, whatever that might mean. Madonna, you are probably one of the most knowledgeable people I know about skin, skin and skincare.
Oh gosh, thank you.
So I love our chat so much, and I think, it just amazes me. I think what you know.
Thank you.
But I want to go back first, I guess, and talk about. Take us back to sort of you growing up. How did you kind of start, and what did you want to be when you were younger? Was it always in the sort of aesthetic space?
So I actually moved to Australia when I was 7, so I wasn't born here originally. I did always want to be in the aesthetic space, but the industry was so different when I left school. Yeah. When I was in year 12, my top subjects, year 11 and 12, were chemistry, and I would participate in the national statewide exams, and I'd always get distinction in all of them. And I think that was, you know, a real moment, because when I wanted to then go into the beauty space back then, my mum wasn't so keen. She did, of course, encourage me to pursue something in chemistry and possibly pharmacy, which I'm so grateful for because of the way that things panned out and the way the industry changed. And it was my best friend and I always wanted to do skin, or beauty rather, together.
Yeah.
She went on to do it. And I remember I'm not sure if you remember, it was one of the first franchises back then. This is going back 18 years now, Advanced something. But it was the age of DMK and Priori, MD solutions, or MD formulations. I can't even remember. But I would on my days off, I would be at the salon. So I was always immersed in it as much as I was any opportunity I had, I would be like, okay, I'm there. But no, I didn't do it straight out of school. Yeah. I went on to do a few other things, did a hotel management qualification and course. And within that, I then kind of did a placement in every single department again, and then found myself in the spa. So
kept drawing you there.
Yeah, it really was. Only when I look back, I think of all the times I went back to beauty. And that is something that just blows my mind. And I'm such a big believer that if you don't ever do what you really want to do, you will always spend your life somehow trying to get back to it. Yeah. Big believer in that, no matter how old you are. Yeah. So in 2015, I saw the shift in the industry. And there was this whole specialization. You know, you started very low-key, started to have people that just did brows, people that, you know, just did facials. Waxing became a specialization. Obviously, laser was massive by then, but just hair removal, not so much aesthetics and skin-driven. So in 2015, I went and had a tour at the Broadway College of Beauty. Yep. They had a degree. They had a degree. It was a tertiary qualification. Yeah. Enrolled in that, and then they closed down not long after. So they went into administration, and then I'm like, oh, well, let's try again. I didn't want to do something that was going to become obsolete in the near future. Yeah. So then I actually just went to start to do Diploma of Beauty. Yeah. And I got accredited for the units that I had already done. And then in 2019, I did completed the certificate, and I was working like here and there in the industry, just part-time, really just taking it slow. I really wanted to understand how the industry had shifted so much from when I was 17, and it was very much beauty treatment focused.
And it's funny because it is, my first job was in a beautician, and it was an absolute, I was 15, I worked on Thursday nights and on the weekends. And it was everything we did, piercing to waxing to facials to massages to nails. It was absolutely everything. And I look back at it, it was wild, you know, and it was, it was in a shopping mall, and it was where, you'd stop in on your way to get your groceries.
Absolutely.
And it does feel so far from where we are now. It really is now much more that age of that kind of specialisation, I would say.
It's amazing. It's incredible. Like, I'm so grateful that happened.
Yeah.
And it's happened so much so that they're actually changing the entire training package. I do see, though, that the elements of spa is nice to have.
Yeah.
So you can always kind of like study more geared towards clinical later if you wish, but especially if you want more of a relaxation element to it, where it's this complete experience of both skin revision, skin correction, and traditional spa, I think the Diploma of Beauty.
Yeah. And look, I think it's really important because there is a real distinction. I think you have that, for lack of a better word, kind of medi spa where it is much more medical driven devices, and you've got nurses and things like that. And then there's absolutely a place for that. But then I think if you are on a skin journey with someone, to be in a space where it is still a luxury and a treat, but you are getting treatments which are actually creating change in your skin, that to me is a journey that someone will go on and want to stay on, rather than, popping in and getting laser by a nurse in a clinical environment and leaving.
Yeah.
It's different.
Yeah.
It's a different experience. You feel different afterwards. And I think, for somebody, whether you love skin or not, that going and getting a treatment is still very much a luxury, And so
absolutely.
Particularly when you're getting some of these devices which are painful or, uncomfortable, there still needs to be that little element of spa and luxury in it to make it worth it, I think, for people to want to stick with it.
And I think treating the skin just from the outside in is something that a lot of people will start to notice that it's not the way forward. Yeah. It really isn't. Yeah. I mean, will it work? Yes. For how long? Yeah. We don't know, because if we talk about the skin from this bidirectional, I guess, approach, is that there's so many other factors. And this time, so many clients that come, they're like, oh, it's so intense, it's so crazy, my skin's flared up, I know it's stress, I know I'm overwhelmed. So to go and just do a clinical treatment that's just going to address these superficial, I guess, symptoms, if we want to call it that, is great. But there's so much more to that, and
Yeah, absolutely. And it's exactly what we're talking about. I think with this podcast, it's really looking at skin finally from an entire holistic view. And I want to talk to you because I know you're very much about looking at skin as like a holistic skin health, and it really is. And I think from everyone we've spoken to, you start to see that it is a puzzle, it absolutely is. Lifestyle factors, diet, stress, all of that comes in. I think we've all known that at a base level, but then how do you bring that all together in some way and have someone like yourself to be a guide to kind of figure that out? Because that's a really hard one for someone, unlike us who probably know a lot about skin. If you are just an everyday person who just has skin issues and doesn't know what to do, you really do almost need to kind of go searching for someone to help. You can go to one of those kind of chains of skin things and get a treatment and probably look good for, the next day and your skin's clean, but that's not going to fundamentally, help and change your skin journey in the long run.
Yeah, absolutely.
That's right.
Yeah.
So, and it's hard, I think, how do you, help people to figure that out, that journey?
I think people have to be also willing and open to receive this information. I think still there is a lot of people that just want to treat the skin from the outside in. Yeah. And, with comparison on social media, which it will help the more people do talk about it, about the fact that you have to address certain issues in your life that's almost causing these symptoms that's just showing up on your skin. I believe every skin tells a story. Yeah. A story from when you were a child, believe it or not. Yeah. Because if we think of pigmentation and sun damage accumulation, that starts as children. Yeah. That doesn't just, there isn't a timer that starts when you're 14, 15 or beyond. Yeah. It's accumulation from when you were a child.
Yeah, definitely.
That's just one aspect of it. Yeah. So add emotional, add diet, add the health of your organs. We know that the skin is the largest organ. It's great that message has been, I guess, conveyed to the audience over the last few years. Yeah. But then there's more to that. There's the fact that your liver is the largest internal organ. So a lot of the skin manifestations that we see could be coming from your liver health. Yeah. And that doesn't necessarily mean that you need a drastic change or you need this liver detox, but diet and lifestyle changes go a long way. And I find that to be the hardest thing, is that not everybody wants to do the work. And I find myself in a position sometimes, well, I can't give them the results that they want because I can almost see that, yes, topical. And I think we have to be careful because you can treat with topical, but your results will go to a certain extent. Yeah. And that's the thing. You're not going to see results, but you're not going to get the results you're after. Yeah. And if people see, Roaccutane, that's treating your skin internally. So I find it sometimes not frustrating, but I wish there was more knowledge and just more education around, well, if you're willing to take Roaccutane, which is a prescription medication to treat your skin, then you have to also look at diet and lifestyle and habits and sleep hygiene and all of those if you want to treat it without medication, not just coming for a few treatments and just...
And look, I think it's even if you want to treat it with medication, if that is the path you want to go down, fine, absolutely great. But there is so many other things, and I have known so many people who have struggled on something like Roaccutane and hated the side effects and really struggled with their mental health through it. And I think, God, there's so much other stuff you could probably be doing alongside it to really help you. I've had a friend who's been on her third round of it. Yeah. And I just think, that's years and years of taking a drug that you hate taking, and that's really hard. So absolutely, I think it's something I've spoken about with quite a lot of guests is there is this real paradox or disconnect, I think, with, like you said, what patients want, what they can achieve, and then in the middle of it all, the effort they're actually willing to put.
That's very true.
And it's a hard one because everyone is busy. Everyone is stressed. Everyone has so much going on. And I think, skin health and the look of your skin is probably very much tied into vanity. And so people think, it's not something that probably needs a lot of mental capacity or should have that. But like you said, if you want the results, though, I can give you the answer, but what you choose to do it is often very different.
And we can see if they're following it or not. Yeah. I think that's also so interesting when they come in and you're like, oh, you haven't been taking this. And they're like, oh, how do you know?
I know. I once had a dentist tell me, we always know when people don't floss their teeth because when we floss them, they bleed. It's very obvious.
Yeah, that's so true. I think you're right in the sense that medication has a role in the industry, but a preventative approach is what I find best it's all about avoiding it, right? If, avoiding sun damage is hard, treating sun damage is harder.
Totally.
Avoiding acne scarring is hard. Treating acne scarring is so much harder. Yeah. Choose your hard.
Totally. Absolutely. And that's the thing. And I love now that, because I think when I was a teenager, that was never talked about. Yeah. People who had horrific cystic acne and now have bad scarring, they were told to go on Roaccutane. They were never told about how to treat the scarring or how to deal with scarring or the emotional effect of the scarring. Yeah. Now I think we are talking about it a lot more, and there are a lot more treatments that we can do for acne scarring and and pigmentation and things like that. So I think that is a good shift we are getting now, that we're really looking at all of those things too now, which probably weren't spoken about previously. But it is. It's like you said, choose which one. Choose your journey. Yeah. Because sure. It's a real uphill battle, and and I always say, if you're not going to wear sunscreen, don't bother using your retinoids and vitamin C's. It's not doing anything.
No, it's really not. And I can always tell if someone's using their sunscreen or not. It's actually quick maths, right? Yeah. Something is 30 mils. You know how much they should be using a day. If they're only replenishing their sunscreen every 3-4 months, you're like, They're like, how do you know that? Because you haven't repurchased one.
I had this exact conversation with my mother. I was at her house last week and found this old decrepit bottle of sunscreen that I must have given her over a year ago that she was still using. Yeah. And I was like, you're not using it, or you're not using enough of it. Yeah. Something's not adding up.
I think the symbol on the back, best use, that should be like a month with a sunscreen. Like, just finish it.
If you're not finishing a bottle of sunscreen I'd give you 2 months at a stretch. Yeah. Then you're not using enough.
Absolutely. Yeah.
So, it's a really tough one.
Especially in Australia with our climate.
Especially in Australia. I think anywhere now. God, you look at the temperatures that, the west coast of America has had at the moment, where they're getting sort of 40-degree days regularly every day. There's no that kind of damage is irreparable if you're not wearing it and not reapplying. And
it's radiation damage. It's the biggest difference between a burn, a regular burn, and a sunburn. It's radiation damage. This is why your DNA is at risk. Yeah. Or your nucleus rather is at risk, because it's not like the burn where you spill a little bit of oil on your skin and it heals. Yeah. It doesn't work like that.
Totally.
So when people, I think, again, a lot of people that understand the way pigmentation works and how it's literally a protective mechanism, they have a newfound appreciation for it. And then also understanding that the sun is, a massive radiation circle in the sky.
Totally, it is. And I think I see it a lot in people who start using skincare and start seeing an effect, when someone starts using a retinoid to begin with, and they start going, oh my God, my skin's so much clearer. Yeah. And then I think, now you've got to get on the sunscreen journey, because it's just going to reverse it. They go hand in hand. For sure. And that's, sunscreen's not sexy. It's not fun skincare. It's, there's innovation in there, but it's not huge. It's just a boring product that everybody has to use.
If you can get the foundations right, like I'll see a lot of, girls in their 20s that will do preventative anti-wrinkle. Yeah. To prevent aging, but won't apply sunscreen. And I think that is something that you've seen in the industry a lot. It's like we're missing the foundation. It's like, totally. In your 20s, you have the collagen there. You have the elastin there. The number one thing that's going to destroy that is sun damage. Yeah. So rather than treating it with something that you do, I'm a big believer, you do not need in your 20s, without a doubt.
100%. It's not, you've got collagen in your skin.
You've got barely any movement. Like, just
stop it.
It's more about preserving. So anybody that's young, I'm like, preserve what you have, protect it. So the longevity of it is there.
Totally. Yeah. It is. And it's, one of those things, I think, especially with injectables, it's hard because there is so much out there, and it's one of those things. It's instant gratification. We all love instant gratification, and it's a very easy win to give you that big dopamine hit to go, oh, I look different, and it might be better.
Yeah, and it's convenient. So definitely, again, it's that doing the hard work, going to your regular facial appointments. But I must say, the best skin I have seen is not the skin that's overtreated with anti-wrinkle.
No, absolutely. It's not. 100%.
And this goes to, in every decade. Yeah. So some of my clients that are in their 50s, and because culture also affects your experience with facial treatments. Yeah. So some of my clients that are in their 50s that, their parents took them for their first facial at 15. Yeah. Their skin is incredible. It's better at 50 than, say, somebody that's in maybe mid-30s that you can see has had an avid relationship with the sun. Yeah. And then had a lot of anti-wrinkle injections. The density, the just the resilience, the strength, the defense system. You honestly cannot compare. So it's always hard when you do facial treatments because with anti-wrinkle injections, you can see the results straight away.
Yeah.
With facial treatments, a lot of the times you can't.
Yeah.
So you almost think that it's not doing anything.
Yeah.
But it's about that.
It's
how's my
accumulation.
skin going to look like when I'm 40 and 50, and what you do in your 20s and 30s ultimately gives you those results in the later decades for sure.
And it's one of those things we've spoken about, getting one treatment, is great, but a real skin journey, it takes a long time and it takes a lot of time. And I don't mean that in that, you have to continuously pay for treatments every single couple of weeks. It's not about that. I think it's about working with someone to come up with a plan of, okay, this is what you want to achieve. This is how much effort you want to put in.
Yeah.
Let's try this and see how your skin reacts, and then we'll keep adjusting as we go, and that is, like you said, it's accumulation. It takes time and it's a long-term game,
without
absolutely
doubt.
It's a long-term game. It's about building that skin integrity so that when you are in your 50s, it's in the best possible place it can be.
Absolutely.
Your collagen is still regenerating. It's still there, and you don't need that filler for volume loss so much or help the structural integrity. That's right. Yeah. Just go straight to a facelift.
Yeah. No filler accumulation, no scar tissue from years of filler.
That's it.
You want to have a little bit of lift? Go for it.
Absolutely. And, that's one of the things. I've spoken to an injector recently, and she said, God, the increase of getting filler dissolved is so huge.
It's a massive
but what
percentage.
we don't know now is the scar tissue that's actually left. Well, they can't dissolve that. That's a surgical thing. And if it does cause problems, there's not a lot that can be done. And that's a really hard one.
I think there needs to be more conversation with injectors and skin dermal therapists.
Yeah.
I think a lot of people think because we don't do it, we don't administer, that we don't know about it.
Yeah.
I think if anything, we can see the implications on the skin more so than somebody that's just injecting it. And maybe, of course, there's a follow-up and everything like that, but not a lot of people stick with the same injector.
Yeah.
Right?
No,
Whereas
absolutely.
we can feel it, we can see it. I think a lot of plastic surgeons are literally begging people to reconsider because they're like, we are opening your skin. Threads are there that haven't dissolved.
Yeah.
It's
really interesting because I think I've seen it recently in the plastic surgery industry where there is this huge shift about breast implants and the capsule that comes up of calcium and scar tissue around a breast implant, and then breast implant sickness and things like that coming out. And I think, God, we see that, and people understand that now that, that's a foreign object in your body and your body is rejecting it and it makes this capsule around it. And I think, how do people not put that together? I mean, that's the same with filler. Different substance, but it's the same thing. It's still, and I'm not saying don't get filler, or it's a bad thing, but it's absolutely something that I think is so flippantly chosen now, where I wonder, in 20 years' time, will this be the conversation we're having about, look at all the scar tissue that was left over. And
the filler industry or the cosmetic injectable industry is what breast implant was in the
and
90s?
That's right, exactly.
And now everybody's removing them. Everybody has kind of, like you said, rare cancers. It can happen with anything.
Exactly.
And I think the hardest thing with injectables is that, and even skin peels. So there's risk with everything, right? It's about making this educated and informed decision.
Yeah.
But with something like injectables, cosmetic injectables, you can have it done then and there.
Yeah.
With surgery, I feel like it's a process that you make over time.
Totally. And you have to sign waivers about all the problems that could go on, and you have to go to hospital, and even that is nerve-wracking.
So true.
It's so different. In the mental capacity that you go through.
And now they're having assessment, they're pushing for pre-assessment before cosmetic surgery.
Yeah.
But also add the pandemic, add the virus, add the different reactions that people are having to things they were having before.
Yeah.
Both topically with skin treatments as well as injectables. So even that has changed.
Even now that there is a warning if you've had your COVID vaccine before you get injectables, or if you've had COVID in the last couple of weeks. And I think, God, it's different, and yeah, absolutely. You know, this is a foreign thing that is going into your body, and and like I said, no judgment if you want injectables in any way. It's just there needs to be a consideration around it, and like you said, I worry that in a few years' time, this will be like the breast implant kind of saga that happens now, which is, you know, it's just an interesting one.
It just should never replace skincare.
Yeah.
It should never replace skin health. And that's what we're seeing. Yeah. We're seeing it being prioritised over other things that are the foundation. So even if you look at overall skin health, like a pyramid, right? Your bottom tier is all about what you do every day, sun protection. And I say sun protection, not just sunscreen, because I feel like sunscreen, how much we rely on sunscreen has failed us as a society. Yeah. People are using more sunscreen than ever, but, you know, the skin cancers are higher because you cannot slap on sunscreen and then go out in the sun. Yeah. You have to take more measures, protect your skin, you know, protective clothing, hat, shade. It's all of that.
Oh, totally. And I you know, it's hard because it does, I think, you know, sometimes I think people are probably exhausted by the messaging of the sun-safe messaging, but I think that's because it's not understood how important it is.
It really is.
You know, it's not understood that a tiny little freckle that could be cancerous on your body could give you a scar up to, you know, 10 to 15 centimetres long to cut out that cancer. And until you see that on somebody, you know, or someone goes through that or you go through that, you can't understand that kind of, that scary reality.
For sure.
You know, and it's a hard one because we're an outdoor culture, you know. I love being outside. I love the beach.
Same.
So, it is. It's a tricky one.
Just making better decisions, that's all.
Yeah, that's right. Hi everyone, I wanted to quickly talk about the sponsor of this podcast, Veladays. Veladays creates simple and highly effective skincare to amplify your routine in the shortest possible time. Veladays creates simple and highly effective skincare to amplify your routine in the shortest possible time. There are 3 clinically proven products that replace an entire 12-step skincare routine so you can do more with less. Veladays is available online now, so head over to the website at veladays.com and take their quick 2-minute skin quiz so you can see how to improve your skincare routine for better results. As a listener of the Skin and You podcast, you can get 20% off your first order with the code SKINANDYOU online now, and the details will be in the show notes. And I think that's really important. You know, one of the things I always say is, if you don't know where to go with your skin, if you don't know what to do, you know, just go and get a skin analysis. Yeah. You know, often they're usually free. Go and see a dermal therapist. Just to find out even your skin type, if you don't know what that is, or if you're confused by what products you should be using for your skin type, and just start there. You know, you don't need to do anything else. Just start there, get a baseline.
Yeah. And simplify.
That's right.
Everybody thinks because, again, the age of social media, you have to have these 10-step routines, and honestly, you can achieve so much by choosing purposeful products, serums. Yeah. It has to be simple. Yeah. All of us start with the best intention. We're like, you know, even when we're starting a new lifestyle diet, we're like, I'm going to do this, I'm going to do that. It's the same with skincare. Totally. People come in with the best intentions, and then you have to keep it sustainable, both financially and realistically, where it actually just kind of slides into their everyday routine and it's not overwhelming. Yeah. Because then that's adding more stress, and then that's going to affect their skin more.
It is. And I always say the skincare industry now is like, or the skincare, I guess, kind of, the skincare industry is like dieting culture. It was like the diet culture in the 90s. You know, it's like, absolutely, you're going to do a juice cleanse, you buy all the juices, you spend a ton of money, and then 2 days in, you get hungry. Yeah. Or you get bored of it.
Drive through markers.
Exactly, you know, and that's like skincare now. It's overwhelming. I can't not talk about skin cycling because I think it's everywhere now. But what I think's hilarious about skin cycling is we've all been skin cycling. Yeah. It's just a consistent routine. Yeah, but I love it because for me, I think, well, this is what we've been trying to tell you. Yeah. Have a consistent routine. Yeah. Don't overuse actives. Yeah. Repair your skin with a good base foundation, and you're going to have really nice looking skin.
It's just the trends. Yeah. People love trends. Yeah. I'm so grateful that skincare is so trendy. Yeah. Just because there's more emphasis on skin quality and skin health as opposed to makeup. And look, there's going to be, I guess, nuances and everything that's happening. Yeah. But it's still, we're better off for it than, say, in the 90s where it was just makeup, makeup. And
that's the thing. I think people ask me all the time, how do I feel about, how, trending things are and this over. And I think, it's only a good thing. It is. You can't say it's a bad thing. I think there's some really great information out there that people can get for free. Yeah. And there's so many options at all different price points. Mm-hmm. So that's not a bad thing. But I think, it's just remembering to bring it back to those foundations and
to you.
Yeah, that's
what
right.
Your skin needs.
Yeah. And, if skin cycling works for you or if that's a structure that you need to go, okay, well, I can do a 4-day week with my skincare and I can remember that, then, go for it.
You're so right. I've always skin cycled, if you want to call it that.
That's right. It's just called a routine.
Absolutely. Because there's days I want to use different acids.
Absolutely.
Days I want to use, and I think that's also some dermatologists, maybe the more consultant dermatologists, the ones that are kind of just compounded formulas, they wouldn't necessarily agree with that because to them, if you're using prescription tretinoin, that's what you use every single night and nothing else. Yeah. But we see that not every skin can tolerate that. So then, but also it gives you an opportunity to use different products on the other days to treat either different concerns or just products that have a different outcome, which is amazing.
Totally.
Because if retinoids are doing something, other acids will do something else. So then them working together is amazing. And like you said, you're giving your skin an opportunity to rest from something, recover from something else.
It is, and I think the thing I've seen that it's helpful, this kind of skin cycling idea, is that it's taken away the confusion of people who didn't know how to layer products and layer serums, I would say, because I think that is a big confusion. Mm-hmm. Can I mix my vitamin C with retinoids or acids with this? I think that is such a confusion that has been overblown on what you can and can't do. So I think in a way, skin cycling's probably helped that, in that just use your retinoid this night, use your exfoliant that night, use your copper peptide the next night, just keep it simple and don't worry about layering if you don't know how to, or if you don't even want to think about it.
Yeah. And also keeping it simple. Yeah. It's one product. Yeah. We're so time poor.
Totally.
That not everybody, again, has the time in the mirror to do a 10-step routine. And like you said, you don't know how much of it is being absorbed. Yeah. Some things do work really, really well together, but not everybody's expected to understand what you can use with what.
No. I think it is just one of those things, if it works for you, go for it. Yeah. And I would say the biggest thing in it is just consistency.
Consistency and patience.
Yeah, patience. And that's thing, if you want to start, I find people get so scared using retinoids, which is so unfounded. Nothing's going to happen to you by putting a retinoid on your face one night, That scared kind of mentality is a really funny one that hinders people from doing things, and it's just be consistent with it, and you'll see results in the long run.
Same with chemical peels. Yeah. You'll be surprised how many people still think of that scene from Sex and the City, and they think that's what's going to happen to their skin once they have a chemical peel. Yeah. But formulations have changed so much over the years, and even with that, there's so many different levels. And with that, though, my mantra for anybody that's unsure, no treatment is better than the wrong treatment. Yeah. You can always pick up treatments. It's a lot easier to do that than to fix, adverse reactions from a treatment that was not suitable for you.
Totally.
And, even if you're starting later, you can get incredible results. But if you've overpressed your skin from a young age, I see that in clinic a lot, and it's always better to, if you are weary, if you're not sure where to start, don't start. Yeah. No, totally. Until you can find someone that you trust.
Yeah, that's right. And like I said, find someone and just go, look, this is, I might come 4 times a year. What can we do to make that worth it for me?
Yeah, for sure. And we have to be mindful of people's time. Yeah. I don't like the whole, you have to come every 4 weeks. Yeah. I'm personally not a believer in that.
Yeah.
Everybody is different.
Yeah.
If you're on a treatment plan, I think you have to come in those times, because the results that we can guarantee or give you have to be carried out together in that time. But then maintenance, it's all about metabolic health.
Yeah.
I see the skin as that. When we talk about metabolic health internally, doing treatments maybe every 6 to 8 weeks, depending on where you are, depending on your goal, depending on what you want to maintain. 6 to 8 weeks, metabolic treatments. Making sure that we're kind of stimulating that skin cell turnover, feeding the skin. I actually see the skin as just like feeding it.
Totally.
Vitamins, nutrients, dermal infusions, anything. And I think once you're a certain age, you do need more, not destructive modalities in terms of laser resurfacing all the time, but energy-based devices. You know, microcurrent, galvanic. There's so many studies on the efficacy of those. I feel like sometimes we've moved so far away from them because we want something instant gratification. But I know from myself, like we actually, our bodies are full of frequency, different vibrations, different energy levels. So to feed that back to the skin is my favorite thing. Yeah,
I think, you know, like me, you are obsessed with energy, which I love. Yeah. And I mean energy in devices in terms of what we can do for skin, because I think really that is the future. Like we can't deny that in terms of the kind of results we can see now from energy devices is massive.
So exciting.
So exciting. You know, they are taking skin capabilities, I would say, you know, to a whole nother level. And I think that's really exciting.
Just keeping the activity of the cell healthy. I think we talk about ATP energy, you know, we talk about it a lot. We know that it's a powerhouse of the cell, but doing anything that's going to increase the amount of ATP energy that is produced should be at the forefront of everything we're trying to do. If it's, I don't like the word anti-aging, but if it's an age prevention goal, and I mean, everybody, let's be real, everything we do is to look the best that we can for as long as we can. So energy-based devices, and again, not necessarily erbium ablative laser or CO2, because they're limited as to how many times you should do them. But focusing on feeding your skin the energy that it already has inside just makes sure that things are working properly, you know, because we lose that. We lose that spark in our skin over time. We lose the ability to generate new skin cells. So everything we do both at home and in the treatment room should, I'm a big believer in, be focusing on that.
And it's just a new flip now. You know, before, skin treatments was all about cleaning the skin. It was about taking out what we could take out of the skin because your pores look smaller or, you know, we can clear out the congestion. And it was all about cleaning. And I think now we are really shifting to, okay, how do we keep this skin integrity? How do we look after the cell health? How can we penetrate to deeper layers of that collagen that we've never been able to get to on the surface?
Yeah, for sure.
That feels so different and just so right to
it
me.
really does. It's an equal balance of taking away from the skin but giving back to the skin.
Totally.
Yeah.
That, you know, that just makes sense in terms of, that makes sense how we're going to look after our skin. You know,
antioxidants comes to mind when you say that, because
I think you don't realize. That's right. You don't realize. You know, we talk about sun damage, but pollution damage is something. Hannah English, who is kind of become a friend through social now, was talking the other day to me about. People don't realize that the pollution concentration inside our houses is actually way more than what it is outside because you're in a small space and it's contained, and we know that gases disperse. And so if you're in a closed house, you know, like we have been in winter, that pollution from outside is stuck in your house and the concentration is so high. Whereas if you're outside, the space is so much bigger.
The air's filtered
so we don't even realize that the pollution damage you're getting inside your own house is huge.
And then add blue light to that equation.
All of it, you know, all of it adds up. And so, you know, that antioxidant protection both day and night is massive. And I think that is going to be a shift we'll see in skincare as well. I know we're definitely looking at it with Vela, is there's so much potential with antioxidants.
Absolutely.
And how do we harness that and make that into a new thing in skincare? Because I think we only really talk about it as vitamin C now, but there is so much more.
But vitamin A in itself, retinol is one of the most,
absolutely
highest source of antioxidants. I love vitamins A, C, B, and E.
Yeah.
E doesn't get as much of a spotlight as it should.
Yeah, I agree.
CoQ10, any of the ubiquinone.
Oh,
resveratrol.
One I cannot say.
Glutathione.
Totally.
Yeah, so many master antioxidants.
That I think have just been added into skincare in history as just an add-on, but we have underplayed them a lot.
But also not forgetting that the antioxidants that our skin needs, our body needs just as much.
Totally.
So oral antioxidants, not synthetic based, and I know some people won't agree, but anything whole food based is always going to be better.
Absolutely.
It's easy to take an ascorbic acid supplement, but there are so many powders. Look, 10 years ago, it was so hard for me to find a whole food based vitamin C supplement that I'd import it and have a freight forwarding from the US. Yeah. Now that they're a bigger company, you can get them, and iHerb has paved the way. But even the rise of the supplement industry, I'm weary of.
Yeah. Oh, completely. It's another sales industry.
It is.
It's another one to make us feel bad about what we're not getting, that most of us are probably getting through our day.
And again, moving away from the fact that sometimes you need to do the hard work yourself, day in, day out.
Absolutely.
With habits, prioritizing protein with every meal, not just taking a collagen supplement.
Totally.
There's a time and place for everything. But you sometimes really need to be guided by, is this suitable for you? Do you need this? And this is what this is what makes a difference between people seeing results and people not seeing results, because sometimes that product wasn't right for them. Yeah. Their bodies did not need it. I've done so many so after I did all the training and I did the second year in Bachelor of Dermal Science. Yeah. Then I've done so many short courses in nutrition and metabolic health. This is why I speak. And I've always loved functional medicine. Yeah. It just also doesn't focus on skin as much,
Totally.
And rightly so. Like, I know it's superficial, but if we, again, go back to the thought process or to the philosophy that your skin is telling you something.
Totally.
It's literally giving you a warning sign.
It's telling you something emotionally, physically, environmentally. It's huge. And I think it's not many people are attuned to probably listening to those messages, whether it be internally or externally. And I think that's a real progression that you can get on. And once you do start working with healthcare professionals or skin specialists, all kinds of, you can start to learn to pick up those kind of triggers or those just signs that are coming out, I think. And that is really important.
Emotional's a massive one.
Huge. Yeah. Huge. And one, that we probably don't look at enough, because especially post-COVID, everybody is stressed. Life is hard. Yeah. Things are going crazy. Yeah. It's a really big one.
We talk about stress, but I also think there's so many elements to it. It's insomnia is a form of stress.
Yeah. Can attest to that.
Yeah. There's so many different levels of stress. There really isn't. Yeah. And I appreciate knowing my life, knowing how life is, that you can't always control the stress. But I'm a big believer, and what I do with all my clients is we support their body to be able to metabolize the stress, and just support their body to, be able to go through this time in your life. The pandemic really did teach us that so very little things are in our control.
Totally.
And the stress that came off the back of that, for a lot of people, it will be long term. You might not be able to change that. There are things in my life I can't necessarily, walk away from or just shut out. Yeah. As much as we should be able to manage the stress as much as we can. Yeah. But then if we can't, we have to support our body to be able to just manage the stress well.
And that would be the biggest difference, I would say, of going to see someone like yourself who really does have that holistic health kind of element to your treatment, rather than, just going to a skin clinic down the road. You know, it's about supporting your body as a whole, and that is what I would talk about as a skin journey. You know, it's not just getting a nice treatment because you want to clean your skin and feel good about yourself. It's about that support long term, and whether you see you once a month or once a year, it's still a process, and it's still, you know, that support that you can get, I think, is very different, and that the money for that kind of treatment is 10 times more.
Yeah, you're getting so much more from it than just the physical treatment that you walk away with.
Absolutely.
I'm so grateful that you think that, because that's literally what I aim to provide. You know,
and
it's
I think you can't not see that once you have visited someone like yourself, someone who does that kind of more holistic health. You can't not notice the difference, and I think that's really important.
Thank you.
I'd like to know, I guess, just as we are finishing, what are some of the kind of sort of skin issues and common things you are seeing in clinic at the moment?
I'd say since we reopened, inflammatory skin conditions have been at an all-time high. Yeah. Whether it's dermatitis, perioral, you know, flare-up of rosacea, flare-up of eczema, anything that is inflamed acne, that's been huge. Melasma, I see it as an inflammatory just because when I see it under the diagnostic scope, I see the vascular component. So rather than treating it with a pill that's going to aggravate that more, for me, I find the best thing, and anybody that will benefit from, is products that are geared towards anti-inflammation. Yeah. We know inflammation is at the source of aging. Yeah. So it's just more about calming that. Yeah. But that would be my number one thing that I've seen. And even people that never experienced it before. Yeah. They'd never had perioral dermatitis in their life before, all of a sudden. And we know with those things, once you have them, they're always going to come and go. So it's about managing them and reducing the flare-ups and reducing the severity of the flare-ups when they do come. Totally. So for a lot of people, that's really hard to know that their skin never had that issue, but all of a sudden it does. Yeah. And
it's interesting though, because I've spoken to, you know, multiple different people from different areas on this podcast, from nutrition to mental health. And the common thread I am seeing post-COVID is everyone is talking about issues with inflammation, whether that be internally and how that represents in the body, to skin. It's a really interesting one because I think that's something we've seen probably around diet a little bit. You know, we've seen athletes who try to avoid inflammatory foods and things like that for recovery, but we've never really spoken about it whole body and how it can affect so much. And I think, that is a really interesting one that definitely it seems like a lot of people are seeing now in practice. Yep.
Inflammation causes premature aging, so, you know, wrinkling, the loss of collagen. Inflammation is so big. I feel like we need a podcast on it. Yeah. You know.
That'll be next time.
Just on inflammation. Totally. And the different ways that it can represent and manifest both in body. Yeah. I call it the silent, almost like the silent illness. Yeah. You know, because it's not something that there might be a test besides your C-reactive protein once it's at a level so high. Yeah. But even before that, you know, it's almost like it's invisible, but it causes so many issues.
Oh, the rise of rosacea alone is insane. Yeah.
It's an immune response. Yeah. It's something happening internally. And I sometimes find it not hard but interesting that people still can't see that what you do internally affects your skin externally. Totally. You know?
Yeah, absolutely. It is. It's one of the biggest things. Yeah. And I think maybe the rise of supplements has brought that to light a little bit, but it's scary though. It's not given us it's not the answer. No, not at all. By any means. No. And it's probably not helpful in certain ways, but maybe it has drawn light to that a little bit. Yeah. And I hope people can see, you know, there are other ways through diet and lifestyle and things like that we can look at trying to fix some of those things without just having to supplement.
For sure. There's a dysregulation somewhere. I studied minerals as well. obsessed with minerals. Obsessed with minerals. And I always see everything is actually like a dysregulation internally.
Yeah.
And the rise of the supplement industry, it's still new.
Yeah.
So it will grow.
Yeah.
It will continue to grow, and eventually we will also see, unfortunately, the implications of that.
Yeah, agreed.
You know, both on our internal health, on our organs that have to process all these. There's this meme, I'll send it to you. It's like there's a queue, there's 2 doors, doing the hard work, taking the easy way out. And literally no one is in the line to do the hard work.
I know, it's human nature, isn't it?
Yeah, it is.
It's a hard one.
And we see big corporations, you know, they're very well aware of how we behave.
Yeah.
I'm so interested in business, I guess the business of beauty and the business of the aesthetics. So I follow a lot of acquisitions, and I find it just mind-blowing to see very big parent corporations buying, you know, like Garden of Life, BioGaia, Bioceuticals got bought out because they know. Yeah. They know that if you can tell somebody, take this pill and you'll fix all your problems, it will.
Totally.
The same way.
It will sell.
The same way with skincare.
Yeah.
You know,
yeah, totally.
We're a lot better.
Yeah.
Because consumers are a lot better.
Yeah.
Consumers are equipped with a lot more information. Yeah. They're discerning. They'll be like, you know, I don't necessarily believe the marketing claims that you're putting forward to me. Yeah. Like they did in the 90s. Magic cream.
Yeah. I guess what are a quick overview of, I guess, the skincare products you think the basics we should all be using?
A cleanser.
Yeah.
I'm going to say gentle cleanser if we're going to keep it really simple.
Yep.
A multi-purpose cleanser.
Yep.
One that's gentle enough to remove your makeup, and then one that can be used as a second cleanse. So a serum.
Yep.
And I'm going to say antioxidant, not vitamin C, because everybody needs different antioxidants.
Yep.
So an antioxidant serum is a must in everyone's routine. Sunscreen, of course.
Yep.
And then in terms of a night, so that's the day. Yeah. And I'm skipping the moisturiser there. I'm like, go straight sunscreen.
Just go sunscreen. I don't even use moisturiser in the day.
Especially in summer, depending on the antioxidant serum, if it's, you know, emollient enough, not everybody needs a moisturiser. And then at night time, it's more of a restorative serum. Yep. Again, depending on you, or more of a refining serum, or one that's going to correct.
Yep.
And then, so that's keeping it
perfect.
So simple.
Yeah, and that's it.
Less is more.
Less is more.
Yeah.
No, love that.
And calm down on the in your 20s.
So I always like to end this podcast on just one easy tip or daily practice that anybody can implement tomorrow to improve their overall health, skin health, whatever you would like. Wow. I will go first to give you a minute to think.
Yep.
I always have weird ones, but mine is very simple today. I think because we are talking skin, I will keep it to that. And it's just to remember that your skin changes seasonally.
Yeah.
So, and I think we've been talking about it a lot now is, you know, you need to just check in with your skin regularly, every couple of weeks, to see if what you are using is right for your skin at that moment. You know, we are going into the hotter weather now. You probably don't need moisturizer if you don't, you know, you just use your sunscreen, you'll be fine. I think, it's just important because I think sometimes, you know, we buy all this stuff and then we just keep using it probably till it runs out and then maybe replace it or buy something else and try something else. And it's just, have a few things that you can check in with your skin and go, I'm really dry at the moment. Actually, probably maybe I need a richer cream today, you know, or it's super hot. I'm a bit oily at the moment. I'll just use my sunscreen. That's it.
Skin changes with your hormone cycle.
Skin changes all the time.
Hormonal cycles.
Absolutely.
So, you know, there are days we'll feel more oily. We'll need more of a lightweight moisturiser. Day by day.
And I think anyone who's been pregnant will understand that because your skin goes through a whole remit weekly when you're pregnant because it's just that exaggerated hormone flux. And absolutely, you know, as women, you'll go through that monthly on a smaller scale. So, and even for men, totally the dips in your hormones change. So I think that's just a really easy one is just check in with your skin, you know, every couple of weeks and think, am I using products because I've just got them or am I using them because this is actually what my skin needs? Yeah,
so true. And sometimes it's fine to make tweaks.
Totally.
You don't have to throw that out. It's not working for your skin at the moment. You always go back to it.
Absolutely.
But I seen an article recently where they started exercising around their menstrual cycle, and I see that as the next thing, because really the shift in hormonal changes at different times of the cycle will mean your skin needs different things.
Completely.
Yeah,
Just like your energy needs different things, your nutrition is different. You know, absolutely it shifts.
Yeah. So I'm going to go, because you covered the skin. I think what I would say is just celebrate your individuality. I think I'm very big on that. I don't know if it's an age thing. I kind of wish that I, know what you bring to the table, know your worth, try not to compare. Yeah. Nothing you do will ever make you like someone that you're trying to be. I don't know if that makes sense. But, everyone's so different. Mm-hmm. At the same time, oh gosh, I don't know, just... It sounds so cliched, but like really be grateful for your skin now. Yeah. Like I look back on my skin in my 20s, I'm like, what I would 100%. Do to have my skin like that again. You're never going to be at
this point again.
Ever.
Yep.
Literally.
And I think it's good. It's go easy on yourself. Sometimes, especially with social media, your skin is not good or bad. Yeah. Your skin is just your skin. Yeah. And it changes.
Yeah. And that's why I said with the skin and the liver, and it doesn't mean you have to fix anything. Yeah. It's just more about knowing what can be causing it. If you're happy and it's not causing you, I will never bring light or attention to a skin concern when someone comes to see me. Yeah. Unless they mention it, I will treat it from the back end. Yeah. Right? Like I'm going to treat their skin. I will cover what they have told me. Yeah. But I will never come and tell them, oh, did you know you have this on your skin? Or did you know there's some... I can't do it. Yeah. Because imagine how, totally. I'm a big believer in, this is probably a nice one to finish with as well. Not a lot of people will forget what you did for them, but they will absolutely always remember how you made them feel.
Completely. Yeah. No, I love that. It is so true. And it's so important because, our skin affects everything for us. It affects our mental health.
It's the first thing you see.
It's the first thing you see every day. Yeah. We're so completely surrounded by looking at ourselves on Zoom and on social media and things, and it's very you can't help but not criticize or compare. And so I think it's so important, and you're so right, you're never going to be back at this point again in your life. And I look at photos of myself 10 years ago and I go, God, look how much collagen were in my cheeks.
I'm like, just give me that jawline again.
And I remember then thinking, God, my skin's horrendous.
So true. So true.
Yeah, it's just go easy on yourself.
Yeah, for sure. And know that there's a lot of help out there available.
Right. Totally.
It's 2022. Like we're so fortunate,
Agreed.
And the reason why I take it upon myself to learn so much more about all these different, I guess, aspects, because we are the first point of contact. Yeah. It's not as easy to make an appointment with a dermatologist. You need a referral. Yeah. Often they're wait lists. Yeah. And also why I always keep days available. Because if it's a last minute thing that somebody needs to see you then and there, imagine having to wait 3-4 months.
No, I agree. I've spoken about that before. It is hard sometimes to see, a derm and things like that. And there is so much more help available. Yeah, absolutely. Reach out for it, because you don't need to suffer from bad skin if it's affecting you. Yeah. If you're having an issue with it, if it's affecting your mental health, you don't need to go through that by yourself.
You really
There's
don't.
So much help.
And the quicker you address it, the less scarring again you're dealing with if it's acne. Yeah.
Yeah. I tell people who have acne, get on it now if you want to, because once you have the scarring, that's a long journey ahead.
Because it didn't become stage 4 overnight.
Totally.
So stage 4 is what we don't treat.
That's right.
Where you need to see a dermatologist because the quicker you get it under control, the less scarring. It's about 8 weeks. Yeah. Like I think that's the rate of, so it didn't become stage 4 overnight. No. So you had stage 1 pre-acne, stage 1, stage 2, stage 3. And then when it's stage 4, you're like, I'm so sorry. It's not even in my scope. No, I'm going to be doing a disservice to you to tell you I'm going to be able to treat it in 2 months,
That's right. No, it is. Thank you so much, Madonna.
Thank you.
This has been amazing. I love talking to you every time.